Good morning. Thank you guys all for joining on. I am going to allow about a minute or so more just to give some time for others to join on. So just going to give it about a minute or so just to allow more people to join on before we officially get started. But thank you everyone for joining on. We should be starting in about a minute or two. Thank you. Good morning. Good morning, everyone. Welcome to the Multidisciplinary Approaches to Ending Homelessness, COC webinar series. I am gonna just give it about one more minute. I see more people are joining on, so I don't want to um, get started before allowing others to join on if they're still trying to. But thank you all for joining on this morning. We'll go ahead and start at 10:03. So just one more minute. Thank you. In the meantime, for everyone that is on the call, if you can all please type in your name um, and the agency you are from in the chat, just so that we are able to have the attendance. Thank you. Okay, so I am going to go ahead and get started. Again, thank you everyone for joining on to our multiply-disciplinary approaches to ending homelessness with our COC webinar series. Before we begin, I'd like to introduce myself. My name is Valeria Cervantes, and I do have Gershom on as well, who will be popping in um, when needed or as needed. We're both excited for you all to be joining us this morning, and we're happy that you are here. So just a couple of housekeeping items before we dive into our presentation today. Please make sure that your microphones remain muted at all times unless you are speaking, just so that we can prevent any background noise. And if you haven't already, please sign in by typing your full name, your title, and the organization into the chat. Um, so with that, I'm going to go ahead and go over today's agenda. Oh, here we go. So again, just the welcome introductions with myself, Valeria Cervantes, and then we have Gershom Hiron, and we're COC staff. And today we're going to have an informational forum on mainstream benefits on behalf of our Department of Social Services, the Self-Sufficiency Division. Um, and again, we're going to allow for questions and answers at the end of the presentation. So if we can all please just hold on the questions till the end. If you guys want to put them in the chat throughout the presentation, you can, but towards the end of the presentation is when we'll go ahead and answer those questions. Okay, And then just about the webinar series. So this is just a great opportunity for all of us to engage with local and regional experts to learn about best practices, advocacy tools, and resources available to prevent and end homelessness. For those who aren't able to join us live on our meeting, the webinars are recorded and they will be posted on our website. So that's at rivcohws.org. They're usually posted after each session. So last month's and the months prior are already up on the website. So please feel free to check them out if you need to revisit any of the webinar content or just um, want to take a look at the webinars that we have on there. Okay. Um, All right, so now I'm excited to introduce our presenters for today's session. We have um, Adriana Magana and we have Ronica Cervantes from the County of Riverside Department of Social Services. Adriana Magana is an eligibility supervisor with the County of Riverside. She has about 18 years of experience in Medi-Cal and CalFresh eligibility within the self-sufficiency division. And we have Ronica Cervantes, who is a community program specialist, also within the self-sufficiency division. So the self-sufficiency division with the Department of Social Services is a program that offers programs like CalWorks, General Assistance, CalFresh, Medi-Cal, Benefits Cal, along with many other resources that help individuals reach self-sufficiency. I'm going to go ahead and hand it over to Adriana and Rona. If you guys are on and ready, go ahead. The floor is yours.
Good morning. Once again, I'm Adriana Magana. I'm an eligibility supervisor with the Community Outreach Branch with County Riverside Self-Sufficiency Division.
And good morning. My name is Ronica Cervantes. I am the Community Program Specialist for Riverside County Self-Sufficiency as well.
Thank you both for joining us today. And if you would like for me to do your slides, just go ahead and let me know just when to click next. If not, you guys can go ahead and present.
Okay, yeah, if you don't mind, we'll say next. Thank you. So next slide, please. So the topics we'll be covering today is going to be an overview of our self-sufficiency division, CalWorks programs, other cash assistance programs, CalFresh, Medi-Cal, Benefits Cal, and we'll have questions and answers at the end. So our self-sufficiency division helps working class people and families with low or no income to find their path to economic independence. We offer access to food, housing, cash, childcare, employment, health coverage. We are customer focused and we strive to provide help quickly to those families and individuals who can achieve and sustain health, well-being, and economic independence. Our programs include, again, CalFresh, CalWorks, childcare, employment services, and homeless programs in Medi-Cal. You can visit our website at rivcodpss.org for more information. Next slide, please. As you can see, if you visit our website, we have different programs. If you click on those programs, it'll give you an overview of the assistance that they offer for those programs. Next slide, please. We also have DPSS brochures, as you can see. It includes our mission, our vision, our values. It tells you how you can apply for our programs, how you can apply online through Benefits Cal, by calling in person at our district offices, in which you can see on on one of the slide on the brochure that you can see the different locations that we have available throughout the county to apply in person. And then the information you would need to apply for our programs, like the proof of identification and other income and other information that's needed. And then also more information about benefitscal.com as well. Next slide.
So some of the programs that self-sufficiency provides to the public is CalWorks, which is known as California Work Opportunity and Responsibility for Kids, Medi-Cal, CalFresh, General Assistance. So CalWorks is a temporary cash assistance eligibility for needy families who have minor children under the age of 18. It helps them with payments towards their rent. It's money assistance that they will receive if they're eligible. The amount of assistance that the family can receive depends on the number of people in the family who are eligible. The citizenship does have a factor to that, and the amount that they receive and the type of assistance that they report. Next slide. And then here's a brochure of that program that helps families who are that are in a homeless situation and they need that assistance. The program also offers other programs such as a linkage program, which connects them with welfare to work counselors to help them guide them with filling out applications for work, how to complete resumes, and other programs, childcare as well. Next slide. And then the other cash assistance programs that the county offers is refugee cash assistance. As listed right there, it's for non-citizens individuals who have come to the United States as refugees, asylees, and then there's a list right there of Haitian entrants, special immigrant visa holders, Afghanistan and Ukrainian parolees. And then there's also the battered non-citizens, women who have been victimized from violence. Then there's a trafficking and crime victim assistance program as well. And then there's general assistance. Those are for individuals who don't have children under the age of 18, and they're adults who are also in need of some cash assistance. Now, this program does depend if they must be a county resident to be eligible for this program, and it's only for a 3-month period unless they are disabled. Next slide. And then, so the application process for CalWorks, it's a face-to-face. They must meet with a worker when they're assigned and then provide the requirements that will be requested from the worker, such as income and property, citizenship status, their age, social security number, residency, shelter cost, work or school status, and if there's an absent parent in the home, that will be requested. Please note that eligibility technicians have up to 30 days to process an application, and the program limits adults to 16 months of assistance. And then there's a picture right there of the card. If they're eligible, that's the card that they would get. That same card is also used for the CalFirst program. Next slide. Now, speaking about the CalFresh program, so the CalFresh program here in the state of California, we call it CalFresh, but it's a federal program that's known as SNAP throughout the whole entire United States, which stands for Supplemental Nutritional Assistance Program. And it's a program to help people be able to buy nutritional food, like fruits and vegetables and other healthy foods for their family. And it's just not for families, it's also for individuals. Eligible customers are issued a monthly benefits each month, so they can be able to use it at supermarkets, food stores, anywhere where they accept an EBT payments. You don't have to be employed to receive these benefits. You can be unemployed or working, self-employed, have your own business, be receiving unemployment benefits. The amount that you receive depends on the household, your income, of course, and then the expenses that you report. And then there's also an allowance of medical expenses over $35 a month if the household qualifies. Next page. With CalFresh, the CalFresh program, there's expedited services. So if there's a family that the household has less than 115 in a month of gross income and less than 100 in liquid resources such as a bank account or cash on hand, or if their combined monthly income and liquid resources are less than a household monthly rent or mortgage utilities, or if they're a migrant and seasonal farm worker who are destitute with less than 100 in liquid resources, they are eligible for expedited services. Expedited services can be met if the customer provides, if they meet that criteria, they can be given CalFresh benefits within 3 days rather than 30 days, which is a normal process. Next slide. And so who can purchase, what can you purchase with your CalFresh benefits? You can use it again at farmer's market. There's a farmer's market match program where they will match you, they will match the recipient wherever they accept the EBT card. If they spend $20 in fruits and vegetables, they'll match that amount and they'll give them a voucher so they can be able to go back to the farmer's market and be able to purchase fresh fruit and vegetables. And again, they can use it to buy vegetables, beans, meat, dairy products, grains, nuts, and other fresh items. There's also the CalFresh Restaurant Meals Program, and a lot of people that are aware of this program, it helps them be able to buy food at fast food restaurants anywhere where they accept EBT. Usually, it's for people who are homeless. We would identify that in their case if they're homeless, disabled, or over 60. That's it. And then some of the programs that the programs offer are, for example, CalFresh Employment and Training. It's called CFIT. This program helps people who want to volunteer for this program to get additional support service, such as be able to buy supplies for school, books, parking fees, gas, safety boots, work attire for them to be able to help them find a job. Next slide. And then the other programs that CalFresh have as well, there's a WIC program, which is a nutritional program for pregnant women, breastfeeding, and also for children under the age of 5, so they can get healthy fruits and vegetables. And then there's also for qualifying participants who are 60 and older and disabled, they can get additional expenses deducted from their budget when they claim medical care, dependent care, or housing costs. And then there's a list right there about those deductions that are allowed. Next slide. And the application process, again, this program is a face-to-face or telephone. And I did not say this earlier, but for the CalWorks program, it's also telephonic. It's just not a face-to-face. So the CalFresh program, just like the CalWorks, the customer has to be interviewed, and to be able, for the eligible worker to be able to determine what it is that they'll need to process the application. There's a list of all the items that will be asked during the interview, such as income, citizen status, age, social security number, residency, shelter cost. If they're attending college, they'll be asked about their participation in school. And then again, the eligibility technician has up to 30 days to process an application unless they're eligible for expedited services. Next slide. And we do want to mention that this year, because of unfortunately a lot of fraud going on with people's accounts, there is a new chip that's being distributed to participants, which will help them protect their benefits from being stolen electronically. The chip is similar to like the chip that we have on our ATM cards. So we encourage customers that when they have an EBT card, before or after when they get this new card, that they also download an app that the state has implemented to help protect their benefits. When my team goes out there to the community, we're encouraging to please download the app if they have a telephone, so they can monitor their benefits and make sure that they don't fall victim to any fraud that's going out there. Next slide. Medi-Cal. So Medi-Cal is a no-cost to low-budget public health insurance program that provides the healthcare services that low-income families and individuals need in California. Excuse me. It helps them so they can be able to see routine visits, immunization, prescriptions, emergency services, preventive services, pregnancy related services, mental and substance abuse disorders. And then there's also dental benefits that they can receive under the program Smile California. Next. All right. Okay, so individuals aided under one of the following programs are automatically eligible to be enrolled in Medi-Cal. Those receiving SSISP, which is through the Social Security Administration, CalWorks, if they're approved for CalWorks, they automatically receive Medi-Cal. And so do those who are refugee assistant, receiving refugee assistance, foster care, adoption assistance, and KingDAP. Next slide. And the eligibility, so right there, there's a picture of the card of it's called we call it a BIG, which it stands for Benefits Identification Card. When a customer is eligible for Medi-Cal, that's the card that they receive. They'll also receive a package from the state for them to select the plan, managed healthcare plan, which is with Riverside County, it's Kaiser, IHP, and Molina. So in order to be eligible for Medi-Cal, you must be a California resident, provide your taxable information, and meet the income FPL, which is federal property income limits for pre-Medi-Cal. And then there's some individuals that will have a share cost, which is similar to like a deductible. That's when they don't meet the income limit, but they're over, but they still qualify. And for those individuals, they're usually disabled by Social Security or by the state, or elderly individuals. And the processing for Medi-Cal cases is up to 45 days. And one more thing I want to add, prior from 2023, we used to request property information to make a determination for those cases that had a share cost. That is no longer a factor when we process a case. That's been exempt from the determination. And anyone who is a California resident living in California can apply for Medi-Cal. Does not matter what their citizenship is. Next page. And so how do you apply for all these self-sufficiency programs? There's many ways. There's no wrong door. You can go online at coveredcalifornia.com. You can go on benefitscal.com. You can call a local office and complete an application over the phone. Customers can call the district office, and they can walk in as well and fill out an application and in person. And also they can get more information in our website at www.rivcodepss.org for a list of offices near their home. Next slide. And then there's also self-service options and benefitscal.com. So we also encourage our customers to apply, to enroll into self-service options because it helps them keep track of their benefits, the status of their application. It gives them reminders about the reports that they need to complete. There's for CalFresh is semi-annual, and then annual, and then for Medi-Cal it's every year. We also have the interactive voice response system when they sign up for that. For the CalFresh program and the CalWorks program, they're automatically enrolled into this service, except for Medi-Cal, they have to opt in. But it gives them information about their cases and how to contact their worker and how they can deliver their information to our local offices. Next slide. And then right here, we have a list of links for websites on benefitscal.com, how to create an account, how to apply, make a case, upload a document, report changes with community-based organizations, and Medi-Cal renewals. Next slide. And this is my team, our team, Ronica's and ours. We're right there. I'm towards the middle. And Veronica, I can't see you. I'm not sure where you're at. Oh, I think I did see you. She's more towards the left. But that's our team. These are the eligibility workers that go out there with the community to assist them with applying for benefits and providing resources and help guiding them with the process and answering questions and just being out there and helping the community.
Thank you, Adriana and Ronica, for the insightful presentation. Now we're going to open it up for questions. If anyone has questions for Adriana or Ronica, go ahead and raise your hand, or you can type your question in the chat. So again, now it's time for questions. If anyone has any, please raise your hand and we'll call on you, or you can type your question in the chat and we'll go ahead and read that out.
I would like to share that we collaborate with housing and our team. So when there's a need to assist customers who live at in a homeless encampment, they're out there helping them with other organizations to help them apply for benefits, and sometimes maybe help them with the reporting process, renewals. Sometimes they might have had their cases continued due to no response from the recipient, because again, a lot of these people are homeless and they don't have an address, and the county does provide them with the general delivery address, which is the post office, to the local area where they live or where they report that they stay at. But we're out there helping the homeless community, and it's a great it's my passion, helping the community, making sure that these people who are in destitute situations are helped.
Thank you, Adriana, for highlighting that portion. With that shared, does anyone have any questions regarding how, um, exactly the individuals out in the encampments are assisted by um, our DPSS department, or with what Adriana shared today? Um, Please go ahead and ask away or type your question if you have one.
I also wanted to add, I we are available to send our outreach team out to assist. We have our mobile outreach van, in which we also have an EBT printer, in which we actually print out EBT cards on the spot. So we are available. I'll put our email address at the community outreach branch at rivco.org. I'll put it in the chat. But please reach out if you ever want us to come out and support. If you want us to have a visit, or if there's an event, we'll be happy to send out our team with our van. Thank you.
Thank
And we
you.
just upgraded our machines as well, our EBT machines, and so they are issuing the new EBT cards with the chip on as well.
Thank you, Veronica and Adriana. We do have some questions in the chat, so I'm going to go ahead and read the first one. The first one is from Shireen. It says, how does an organization partner with your team to have someone join us during our outreach or office time to work with participants?
If you could just send me an email, I'm usually the one who responds to the community outreach email. So if you could just send us an email, just letting us know what you would like for us to provide, a presentation or outreach, and then we can figure out a date and schedule that for you.
Thank you. And Ronica did go ahead and share her the email address on the chat. So I went ahead and I pinned it, but it's in the chat for those of you who would want to save it. We'll also share this once we provide the webinar on the website, so that you guys have that contact information. We do have a second question as well. This one is from Niha, and it says, I would like to have you present to our school district homeless liaison. So I guess not so much of a question, but kind of more of just already asking for a partnership there. Um, Again, the email is on the chat, so I believe just reaching out
Yes.
to that email, and then you guys can go ahead and get that scheduled.
Yes, thank you.
So the other question we have on here, how often can a person apply for GR?
I can answer that. So they can, a customer, if they're eligible, they'll receive it for 3 months, and they do have to participate with job searches, or any other requirements that the worker requests from them. Once the 3 months are over, they can always reapply 12 months from the month that the last month they applied. So they applied, let's say, for example, they applied on the 2nd of April, they can reapply again in a 12-month period, which would be April 3rd. It has to be pretty much 365 days from the last time that they applied. So it's every 12 months, and they could receive in a 12-month the benefits for 3 months. If it's a disabled recipient and they verified it with the worker, they can get it for 6 months and then be reevaluated every 6 months. If they're claiming to be disabled, then they have to provide to the doctor proof of that disability. Mind you, if they're not deemed disabled by Social Security yet, they would have to provide information from the doctor who would then, if they are disabled, if the doctor indicates that on the paperwork that they are disabled, then they can receive it for 6 months.
Thank you, Adriana. We do have one other question on the chat. So it says, how does one apply for the CFIT program and how do they get ongoing assistance case management?
So that in order to apply for CFIT program, it's voluntary. They would have to let the CalFresh worker know. So then the CalFresh worker will connect them with a welfare to work a worker, and then that welfare to worker will give them all the resources and needs that they need for that program. That's a bit out of my expertise. I'm not sure what the welfare worker does completely with them, but they do help them with their cases and resources and information that they can provide to them that the recipient has.
Okay, so just an add-on to that question, and again, this question was from Roman. Roman, it says, and if they don't know or have a CalFresh worker?
They have to be receiving CalFresh in order to be able to voluntarily enroll to this program, CFIT. So I'm not sure if I answered your question correctly.
So
Did
then
you mean
just
like if they didn't know about the program? Oh, okay.
so then just for the CFIT program, the individual does need to be receiving CalFresh to
Yes.
be eligible. If they're not receiving, then they would not be eligible for it.
Yeah, they have to have an active case in order to enroll, and again, it's voluntary. So we do provide when the customer is eligible for CalFresh, we do provide them this information to connect them with a welfare to work worker.
Thank you, Adriana. Um, Once again, if anyone on has any questions, go ahead and you can raise your hand and we'll call on you, or if you'd like to type it in the chat, and we'll go ahead and read it out. As of right now, I don't see any questions that haven't been answered, so I'm just going to allow a minute or so just to see if anyone wants to ask a question or type something in the chat.
And I do want to mention too, there was a time where I used to do general assistance applications, so it just popped in my mind right now. The program is just not for CalFresh recipients, but it's also for those who are receiving general assistance as well.
Thank you, Adriana. Okay, I'm not seeing any additional questions in the chat. So let's see, I do see that someone typed something in. Benefitscal.com is also a way to get updates and connect with their workers if they have an active case. So thank you for sharing that, Renee. Um, I know you did mention, Adriana, a little bit about Benefits Cal. Would you be able to share a little more information regarding what that is? Because I believe I myself have encountered some individuals who receive CalWorks, but they don't know or they're not using Benefits Cal yet.
Yes, so Benefits Cal, it's a way for them to go online and enroll create an account so they can again access their case information. It's part of the self-service options. Excuse me, self-service options. So it helps them request assistance, submit request forms, complete their eligible renewals, report changes, receive messages to from their worker and send messages to their worker, and just get an overview of their case information when they want to when they want to log on and check it out. So we usually when we're out there, we tell the customers sign up first for benefitscal.com so then apply for the benefits so that way that account is already set up for them. And it also sends them reminders. So just like the notifications that we get on our text phone or any account that we have, it sends them notifications as well. So it's a resourceful tool for them. We encourage people to sign on for an account.
Thank you, Adriana. Okay, I'm not seeing any additional questions or anyone raising their hand. Um, so this will be last call for any question to please either raise your hand or to type it in the chat. Okay, no questions, no further questions that I see on my end. So we'll go ahead and conclude the question and answer session. Thank you so much, Adriana and Ronica, for joining us and for sharing this presentation. If anyone has any questions later on, you can always feel free to email us at the coc@rivco.org email. Um, and we'll go ahead and provide a response to you. If again you guys are interested in seeing the webinar once more, we will be posting it onto our HWS website, and we'll send out an email just letting you guys know that it is posted. But thank you again all for joining us today, and to our presenters as well. Thank you guys for your time and for showing or sharing this insightful information. Um, I do want to go ahead and share that our next webinar is um, set for May 7th, and we will be going over trauma-informed care. So we'll go ahead and share more information about that once we approach the date. But thank you all for joining us today. And we are finishing a little early, so we'll go ahead and give you guys back your time. But thank you all for joining them, and we'll see you guys all next month.
Thank you very much, guys. Thank you, Val.
Thank you.